Okay. Good. So in this, our meeting, I will hit different points that are key points that are not treated and are not discussed generally, that answer several questions that are still without the answer. So the things that we know that we have different symptoms of this virus and could hit different persons. But for example, the heart is involved very actively, and very little persons they know about this, that quite 50% of the persons that they die from the heart and not from the lung. And there's a situation that is similar to cardiomyopathy, acute cardiomyopathy, which is acute infection of the myocard, or the muscle of the heart, that leads to arrhythmia and to a heart failure. And this could happen sometimes suddenly, and this is the reason why maybe you see in the television some persons that are in the street and they are dead in the street, and nobody understands how it could happen so quickly. So in the autopsies, they found actually the involvement of the heart, and here we have two kinds of lung involvements. The first one is the wet one, in which we have a lot of liquids and fluids inside the lungs. And the other one is the dry lung. And these are two entities completely different, that the way to treat them is completely different, because the wet one, to use the ventilator and to give oxygen is good and could save life. In the other one, the dry one, actually there's no perfusion, there's no flow of blood to the lungs. And that's in part due to the presence of clots, the coagulation of the blood in the arteries of the lungs, or due to the fact that the heart is become weak and has no the force to push the blood to the lungs. So in this situation, the ventilator is not good enough. It's not good at all even. And this is the reason why you hear that they are speaking about ECMO. ECMO is like a pump out from outside of the body that pump the blood and oxygenate the blood, just to help the heart to manage the acute phase till it will be stabilized and to go to normal function of the heart, more or less. Now, why all this fear and anxiety from corona? If we look to the how contagious is the disease, we see that it's not so far from the seasonal influenza. So the reproduction number is the number of patients that are can be take the contagious from another person. I can show you here, for example, that you see that in the MERS, for example, we have the 0.8 the reproduction number. That means barely every person can barely infect another one. In the influenza, it's 1.5. That means every person can infect one and a little bit more. The Ebola, 2 persons. The COVID-19 is 2.5. It's less than the SARS, less than mumps, and less than smallpox that arrived to 6% of contagious. So this led to an expansion of the disease in different countries, and the rate of expansion is different from one country to the other. And you can see the time to double every day, to double the quantity of persons that are infected from the virus. You see, these lines are the time needed to double the quantity of the persons that are infected. And here we have the time, and here in the y-axis we have the quantity of the persons. And you can see, for example, this line here, the red line that is long, this is China. Here is China. You can see here that we have, if China reached the plateau and still there, even there's no new cases. That means if the line is straight, that means there's no new cases. And you can see the way that the curve is behaving has a certain pattern, and this pattern could be changed by the social isolation, social distancing. The purpose of this is just to make this expansion, or the rate of expansion of the disease longer, in order to be able for the health system to cope with all the patients that could be in a very critical case. So right now we are speaking about 1,867,000 cases of coronavirus, and deaths about 115,282 cases. So these numbers is, it seems very big, very anxious, get anxious and fear from these numbers. But actually, if we compare this to other diseases, for example, if we compare this to the Ebola, you can see the Ebola, the 50% of the persons that with Ebola was died. Here, with the influenza, you can see that 0.1% of the person with influenza, they die. And the COVID-19 is 1% to 3.4%. You know, in certain places like Italy, it arrived to 10% of mortality. But this number is not a true number, because this number is the number of persons that they checked. And if you check persons that they are active because they have the flu, they have signs of the disease, that mean you neglected about 3 times or 4 times more persons that they have the coronavirus, but you didn't check them. So it gave a false result of mortality that is very high. And we have to be aware about this. So we can, from all that data that we have today, we can conclude that more or less, we may speak about a mortality about 2.4%. This is the mortality. It seems that, you know, the flu is much lesser mortality than the coronavirus, but we will see immediately that in the case death that we have in the world and in each country, we have a lot of more deaths with the flu than the coronavirus. We will see it immediately. So here we have the death rate in patients with pre-existing conditions And we can see that the people with the heart disease, precedent heart disease, they have mortality about 10%, while persons that they are not with any previous condition, the mortality is less than 1%. So it depends here on the pre-existing condition, but we will find out what makes people different one from another, not because they have the disease, but there's another condition that we have to take in consideration, and I will speak about it later. If you look to the numbers that we have every year with the flu, with the seasonal flu, it's interesting to see that in the United States, for example, the estimation for the year from October 2019 to February 2020, they estimate, the CDC, the Chronic Disease Control Center, actually estimate that it would be between 20,000 and 50,000 deaths from seasonal flu. So we have numbers here. In 2018, in United States, there was 61,000 deaths from seasonal flu. And last year, 2019, there was 37,000 deaths from seasonal influenza. So we are speaking about numbers that it seems that quite impressive, the quantity, and you can see here the numbers, and you can see how much we are speaking. For example, between 2017 and 2018, we have about 45 million Americans that have been with the influenza disease. In Italy, that it seems that it's something that is happening very wrong. In Italy, each year they have about 17,000 deaths from seasonal influenza. About 8,000 only from pneumonia. So the numbers are more or less the same numbers. It's right. That's right that the coronavirus is more contagious than the flu, but it seems that something strange that in previous years nobody said anything about this. And if you compare to other diseases in each year, you know, here I just give them example of how many persons they die each year from heart disease. In the United States, more than 500,000 persons they die from heart disease. From cancer, more or less the same quantity. And interestingly, that from medical error, this is the third place that lead to death. And it's much more than what coronavirus is making or could make with this mortality. So nobody makes any prevention against all these deaths that we have here. And we are exaggerating in the measures to deal with the problem. Now, after that the virus enters inside the mucosa, enter inside the cells, first of all here, there's something that's very important to understand, that the virus could not affect the normal cells. Normal cells, that mean that they are vital cells, that they have a good vitality. And the vitality of the cell is measured by how much electricity has. Because in outside of the cell, we have positive charge. Inside the cells, we have negative charge. The virus itself has a positive charge outside. So if the positive charge will approach the cell which with positive charge, they will repel one from the another, and the virus cannot be connected with the receptor that has in the surface of the cells. And this is a point that you can see it here clearly. You see, I'll take this on the side. You can see here the virus, and with the positive charge, electric charge in outside with the yellow, and the positive charge of the cells. If the cell is enough strong, it never will be able to connect with the receptor to enter inside the cell. So this is the main thing that we should understand and know, that if our cells are strong, there's no problem. Now, every year we have a seasonal flu, and this seasonal flu will attack the weak cells. So the virus is helping us just to destroy the weak cells in order to prevent these weak cells to convert to cancer cells, because the cancer cells actually are cells that are very weak, and they feel like a menace, like a threat of death. And in front of this death of death, they start to replicate the cells in order to survive. That means the cancer is not a fault of the nature, but is reaction that has the scope to survive. However, you can ask how it could be that the cells are multiplicating to survive and the person die. Yes, he does not die from the cancer. He died from lack of vitality in the body. So the death is related to of lack of vitality. In the same way here, if the virus helps us to take out these cells that are not functional, not function good, and are in the end of their life. However, if you have a lot of these cells that are very weak, the quantity of the cells that will be destroyed by the virus will be very large. In that time, the immune system will react to repair the damage. So there's no fault in the immune system. It's not the immune system that was overreacting. There's no overreaction. The immune system reacts to the damage. If the damage is very big, is reacting correspondingly to face this damage and to fix it. In the meanwhile, this acute inflammation will cause an edema and fluids inside the lungs that could lead to the death. So from one side is a positive phenomena, this virus, if we have a certain number of cells, but would be converted to negative if the person is very weak and have a lot of cells that are very weak. In this case, you can see here that if the cell has no positive charge in the surface, So they will be connected to the receptor. That receptor is angiotensin converting enzyme receptor 2, and when it combined to the receptor, will go inside the cell and infect the cell and start the replication. Here we have a schematic presentation what could happen when the cell and the virus on the left side, the cell and the virus are present. The cell is strong cell that we can look to the pH, the acidity of the environmental of the cells is alkaline, 7.3 or 7.4. And this is not the point. The pH is not the point. It's just a sign of how many energy the cell has. Because the more the cell is weak and less energy produced, the more is exposed to the harm effect of the radiation or other effects that could lead to the disease or the death. In the right side, you can see that the pH of the extracellular cell is acidic, is acid. 6.2, 6.9 is acid. That means that the cell is not vital, and in this case will be attracted to the cell. And very interestingly, have been done a study to use the coronavirus from animals to kill cancer cells of humans. And if somebody is interested, I can give the reference and the article that has been published about the use of coronavirus in order to kill the cancer cells. And it has been done, this kind of research. And this come to confirm the theory, actually, because the virus could not attack cells that are healthy and strong. Here we have microscopic, electron microscopic picture. You can see the virus in the surface of the cell. When it attach to the cell, then the membrane will be open of the cell, will be open, and the virus enter inside and start the replication to produce all the parts of the cell. You see here the replication, transcription of the RNA and translation from RNA to proteins and to construct the different parts of the virus. So you can see here actually that the virus, once it's inside the cell, start all the problem of the infection and replication. I was interested to know what is special in Wuhan in China and what is special in the area of Milan or another areas. Why in these places we have a lot of spread of the disease, while in other places we have not. And something that is very evident is the pollution of the air, very heavily contaminated and heavily charged with a positive charge. You know, the quality of air, and this thing that we will see in the seminar, because actually in the seminar we will see all these things starting from the first point, asking the main question, what is life? And before we ask what is life, how the universe was created and how the energy was converted to matter. And this is very important because once we understand the relationship between the energy and the matter, we can understand the relation between the soul and the body. And we can understand the role of the psyche to create the dissonance inside our body to weaken the different parts of our cells and to be exposed and to convert to the disease. So in the second seminar is very important because we will see and discuss the relationship between the psychological conflicts and the specific target in our body, because for each conflict we have very specific target, very specific point, organ, meridian, or chakra. So there's nothing that is randomly diseased like this. We will see that actually when we are exposed to a harmful environment like radiation or like contamination of the air, actually the part that in our body is very weak will be the first one to be contaminated, and the first one will pay the price of this contamination. So it's very important, and it's like to understand actually to measure the quality of the air. We can measure the quality of the air in how much negative ions the air contains, because negative ions are electrons, and when we have a lot of dust in the air, the electron will be captured by this dust and will be inhalated. So the final quantity of the negative ions will be very low. Normally, in a normal city, we have about 5 negative ions for each positive ion. But if you go to the village where you have not industry, you can find 40 negative ions for each one positive ion. And if you go to the mountains, even though that you have a very diluted oxygen, you can find there 400 negative ions for each positive ion. And these ions, when we breathe it, goes inside our body, will reinforce the cells and give negative charge inside the cells, and this will attract the positive charge outside the surface of the cells and give the immunity for the cells. You see, one question is very important: how is important the social distancing or isolation? Well, by isolation, we do not decrease the quantity of persons that will be infected by the virus. The only thing that we are doing actually is just to flatten the curve. To flatten the curve, that means that the medical system could be able to face and handle the patients, because if all patients will be at once sick, the health system will be collapsed, and the number of deaths will be very high. And this is the reason of social distancing or social isolation, just to give the possibility for the medical staff to face it. Another question is how long it would be. Well, we have evidence that the seasonal flu comes and goes periodically in the season period from November to April. And this is the seasons where we can see most of the deaths and disease are in the months of the winter. So there's no reason to think that coronavirus is different in its behavior than the seasonal flu. So I'm confident that the curves will be flattened, and already we are witnessing that in China and in Italy and in other countries, in Israel as well, the curve is already, we reached the peak of the infection number of the disease, and we started the plateau that will go after that to the decrease the number of the disease. So the coronavirus is behaving exactly in a similar way like the flu. And here we can see the peak of the seasonal flu, and the peak normally is in February, March. February is the biggest flu season, and after that it goes down, and in April normally it will vanish. There's something very interesting that I noticed in the curves, in the quantities, the number of deaths from seasonal flu, that from year to year, the number of deaths is increasing. You can see from 2004 till 2018, we have just a crescendo line that goes up and up. So we have some fluctuation of the number of deaths from one year to the other, and this is normal. But in general, we have a line that going up, and the number of patients that die from the disease is increasing with the years. Another thing is very interesting and very important, and I think nobody spoke about it, is the correlation between the sunspots and the seasonal or periodic pandemia. And what I noticed that every 11 years we have pandemia. So it's come to answer the question, if we will have the same coronavirus next year? And the answer is no, because the next time that we will have pandemia would be in 11 years from now. So the sunspots is very interesting issue that has been studied and has been noticed widely, and there are a lot of studies that demonstrate the relation between the number of the sunspots. These are the sunspot cycle number you can see here with the years. They started very early to look to the sun and to the spots. So we have a lot of data about the number of these spots. And if we look to the number of sunspots and the pandemia, you can see a very interesting pattern that you have pandemia each 11 years. And these pandemia are directly related to the number of the spots on the sun. But and the very interesting pattern as well, that we have the pandemia appear not only in the peak, but it appear in the throat, the lowest part of the number of these sunspots. So that's right that the majority of the pandemic influenza outbreaks, it happened to be with the minima and the maxima of the sunspot number. So we have minima, we have maxima. The minima, when we have quite no sunspots, here we have another diagram that shows where here the area of the sunspots was correlated to the pandemia, the different pandemia in the past. So this come to answer the question of the suspicion of the 5G to be responsible for the pandemia. And my feeling is that it is not correlated. It's not correlated because we don't need the 5G to have the pandemia. We have enough radiation from the sun. And another thing is, if it's 5G, why only certain person that are, they have the disease and other not? So the external radiation, the external triggers, stimuli, are only a stimuli that discover the problem that we have. It does not makes the problem. If we are in good shape and we are in harmony with ourselves psychologically and spiritually, our body will be balanced as well. And we will have the homeostasis. And the homeostasis is a state of dynamic equilibrium that allows to the system to function in very efficiently with very low expenditure of energy. So the right thing is the thing that does not need a lot of energy. So a person that their energy is very low, they are the first one to be exposed to this problem. Here we can see the curve that is related to the sunspot, and you can see in the right side in the bottom, you can see that we are in the minima of the sunspots. So it was even expected from NASA that it would be in this year would be pandemia, and I found published materials that expected that in this year would be pandemia. And normally nobody gave attention to this. And here you can compare the left side where you have the maxima of sunspots, and this in the right side, this our sun in this period. It's real image of our sun in this period, and you can see that it's quite completely clear. There's no sunspots. It's interesting the relation between the sunspots and how it influence our health. We have two things actually. When the sunspots in the maximum, there's the number of the the number of the burst explosion that we have in the sun is makes that we have a lot of magnetic winds and magnetic materials that influence the magnetic field of the earth, and it could change the protection shield that this magnetic field gives to the earth. So the more we have this kind of magnetic radiation, change the magnetic field of the earth. But when the sun is in the minima as well, you can see the measure The, the cosmic ray flux, cosmic ray flux in the minima, it seems that we have less energy that arrive to the Earth from one side. So the magnetic field even of the Earth will be weaker, and it allows to the radiation, like the radiation of neutron and muon, these two kinds of radiation that pass the magnetic field, and it could cause the mutation of certain viruses, especially the RNA virus that is very susceptible for mutation due to this kind of radiation. Now, to understand this and to understand the dynamic of the 11 years cyclicity, actually we can understand this because I wanted to understand what happens in these 11 years of cyclicity, and what I found out that there is cyclicity between the two poles of the sun. Once the energy is in the positive pole and once in the negative pole. You can imagine that the same way that we have winter and summer in the earth, you can imagine that there's winter and summer in the sun, not in the sense of the temperature, but in the sense of the polarity. Once the sun that is looking to the earth is in the positive pole, and once in the negative polarity. So when it in the negative polarity, this is the minima of the sunspot numbers. And that will be the period when we have more susceptibility for the diseases. Now somebody could believe or think that this radiation influence the temperature of the earth, and this why we have these pandemics. But from studies that measured the temperature and the solar radiation, it became very clear that there's no relation between the solar radiation and the temperature of the earth that is continually increasing temperature. So the effect of the radiation is not through the temperature of the earth. Now, something is very important to remember is I spoke about the vitality, and the vitality actually, it does not depend only on the age, because if we understand what makes vitality goes down, so we can prevent even the diseases, and we can achieve the point that we can arrive to a very late age and to die healthy. And somebody asked, if you are healthy, why you have to die? Because we have the cyclic that we have to complete. And in the first and second seminar, we will see that we have universal laws, which are 7 universal laws. And with these laws, I describe quite everything that we have in our reality. And these laws explain to us that our life is a kind of wave that it starts with the excitation phase, and expansion, contraction, and relaxation. These 4 phases, I call these 4 phases of life. These 4 phases are vital, not only for us as individual, but for every organ and every cell should pass these four phases periodically. And if we have blockage in one of these four phases, it will appear the disease. So to understand this, we have to take in consideration the energy that goes up and down. For example, if we look to the heart, it's very evident the heart is functioning in four phases. And I am like a cardiologist, all the time look to the phases of the heart and start to understand that what is happening in the heart representative of what is happening in all the universe. Our universe will pass these four phases. The first phase was the Big Bang. And we are right now in the second phase, in the expansion phase. After that phase will be the big crunch, the big contraction. And in that contraction, everything will be imploded and everything will be destroyed inside a very big black hole that converts again the mass and the matter to convert it in energy. And this will happen after 48 billion years. So we have laws, we can understand the nature through these laws. Even we can understand the laws of physics, what the origin of the laws of physics. So what I wanted to tell you here, that actually we can have person that is very young, but the vitality is low. And these persons actually are at risk to be with the disease. And we can have persons that were very old with good vitality, and they will be protected from the disease. So the question here, how we can increase our vitality. And vitality, I mentioned before, that is measured how much electricity we have in our body. And this electricity is expressed of how many electrons we have in our body. And these electrons are expressed in how much free radicals we have in our body. And the more free radicals we have, the less electrons we have. So we can understand the relation between the free radicals and the diseases that we have. The more free radicals in our body we have, the more chance we have to have diseases. And right now, more than 100 most common diseases that we know are related to the free radicals. So, yes, it's good question how we can measure or assess the vital energy. I will mention this. First of all, we have to understand that we have to consider the lifestyle. This is the main thing that we have to take it in consideration when we want to make a good medicine. So good medicine is not the one that deal and treat the disease. Good medicine is the one that is able to prevent the disease. Unfortunately, our conventional medicine is not able to prevent diseases, and has 2 points that are very weak: to prevent disease and to deal with the chronic disease. As a matter of fact, the chronic disease, they are increasing continuously. So these two kinds of disease are a problem. We are excellent to deal with acute disease. We excellent to deal to save lives. We are excellent to do operation and to save the lives of a person. Me, myself, I'm cardiologist, and I'm working as a hemodynamist. So I'm making angiography and angioplasty of the heart. And I deal every day with the persons that come with heart attack, and to open the arteries and to prevent actually the disease, to prevent the damage of the myocardium. And this kind of intervention decreased the mortality significantly. In 2002, the mortality from heart disease it was about 10%. So 10% of the persons that they have heart attack, they were dying. Today, with the acute coronary angioplasty, the mortality decreased to 3%. Okay, so this is a very effective way to deal with acute cases. However, the chronic disease are continuously, they are increasing, and this is a very big burden for the quality of life of the persons, and from the economical aspect is very a big problem. So to deal with this problem, we have to define the health according to the World Health Organization that defined health as a complete physical, psychological, and social well-being, and not merely absence of disease. So we are now dealing all the time, we want the absence of disease, and we think that the person has no disease, he is healthy, and it's not right. Healthy if you have well-being, and well-being is a state of mind in which the person feeling that is able to achieve his aspiration in life with sense of love, happiness, and freedom. And this is the way that we should deal with health. We should deal with health and to introduce the psychological aspect to the medicine, and to introduce the spiritual aspect to psychology. Because in psychology, there's no spirituality. And in medicine, there's no psychology. So we have to complete the picture together and to look all to this as a holistic model in which everything is meaningful, everything is important in our life. Whatever thing that could change your quality of life, change your well-being, it could as well influence your state of mind and state of health. So we have two different aspects here. The first one is the vitality, and the second one is the stress. These two states actually are the most important things that determine the state of health. The more stress you have and less vitality you have, the far you are from the health. So in order to keep health in good state, we have to reduce the stress and increase the vitality. The mean is not enough to decrease the stress, because many persons, they make a good work and they work spiritually and they elaborate the psychological aspects. Still, they are with the disease and they are suffering from the disease. The first thing to increase the vitality is to go sleep early. And when I say early, is 10 o'clock, not later than this. So we have time, so we can speak. It's not here, it's 9 o'clock, so we have another hour. Go to sleep early and sleep enough hours. But to sleep early is more important than the number of the hours, because you can sleep number of hours, but not in the right time, your body wouldn't have enough sleep and wouldn't have enough vitality. The second thing is the vitality is your physical activity. We have two kinds of physical activity: aerobic activity and anaerobic activity. The aerobic activity reduces stress, while the anaerobic activity increase the vitality. So we have two kinds of interaction or intervention that from one side decrease the stress, and from the other side to increase the vitality. Something is very important for the males is to prevent the ejaculation. The liquid, the semen liquid, is very rich with vitality, and this is something that we are not aware about, that males are losing their vitality with the ejaculation. And this is the reason why we should, first of all, take in consideration our age to calculate how many times we should ejaculate according to the formula. The age times 2 divided by 10, and the number that you have will tell you how many how many days you should keep without ejaculation. For example, person that is 40 years, once every 8 days. Person with 60 years, once every 12 days. But this is only the beginning, because we should understand that we have the technique that teach you how to reach the orgasms without ejaculation. So this will keep your energy and vital energy high, and you will keep it to prevent the diseases, not only the influenza or the corona, but all the other diseases. The French called the ejaculation petite mort, the little death. And this is because they understood that actually each time that you lose this liquid, you lose a part of your life. The Chinese, they understood this more than 5,000 years ago, and they developed the technique how to reach and achieve the orgasm, which is named the male Tao. The male Tao is similar to the Tantra in India, a little bit slightly different, but is the principle is the same principle. The third thing is to drink the vegetable juice. So whatever antioxidant alimentation you have, it could help you to increase your vitality and increase your electricity in the body. And this, you can measure it by measuring the face angle. The face angle is a system that you can use it actually to measure. I can show you actually what is the face angle. The face angle is measuring the resistance and the reactance of the body. The resistance is to tell you how much resistance you have in your body by putting 2 electrodes in the hand and 2 other electrodes in your legs, the feet, and you measure the resistance and you measure the reactance. The reactance tells you how many electricity you have in your body. So the more the resistance is high and the reactance is low, the less energy you have in your body. And these are the electrodes. Just I will show you the electrodes, how it looks like. You can see here. I will share with you the screen. Here we have. You can see here on the screen the electrodes that we put in the hands and in the legs. So you see that if you have in the legs, no, just in the hands here. And we measure, you can see here what we are measuring actually. We measure the you can see here in the right, the phase angle. You see in the lower part, the resistance, and in the y-axis, we have the reactance. And the resultant is actually the impedance. And this impedance makes an angle, and this angle, the higher, the bigger is the angle, the healthier is the person. And you can see here the correlation between the angle and the health of the person. You can see here that healthy person, they have 12 degrees of the face angle, and the normal people, they have about 7 degrees of this angle. I can show you the correlation between the face angle and mortality. So we can, with this manner, we can even make prevention. We can know who is at risk. For example, here we have example of persons that with the heart disease, and they measured the face angle. Persons who have 5.7 degrees face angle, you can see the survival is very good, comparing to the one who has the face angle less than 4.2 degrees. And you can see the in the Kaplan-Meier survival curves how in 3 years these are deaths from all cases. It's not only related to the heart. They are in heart patients, but they die from all cases. And this measurement is made exactly in 2 minutes, not more. In 2 minutes, you have this measurement and you have this information. And you can, if I write down in Google face angle and mortality, for example, in cancer, you can see the relation between cancer and different cancers. Here we have this angle. Here they use as diagnosis, as a prognostic factor. You can see in the right side here, just to give you the survival probability by measuring the face angle. So this face angle, you can measure the vitality, and with the heart rate variability, you can measure the stress. So with very simple 2 measurements, you can have the idea about how much at risk that person is, independently if it's 90 years old or 30 years old. So if these measurements are not good, you are at risk to have the infection and to have the disease from different reasons. So This is very important because it leads us to the connection between the psychological aspects and the physical diseases. Because when we have an event, the problem, obstacle, or difficulties in life, if I accept it, I can learn from it. If I refuse it and reject it, the event will convert to conflict. And the conflict creates dissonance in the system and destructive wave interference. That means that we have two waves that are counterpart one to the other, and that would lead to the decrease the vitality of the energy in that organ related to that conflict. Just to give you some examples, the heart is related to conflict of separation from beloved. The lungs related to conflict of abandonment or fear of death, abandoned from parents or fear of death. The colon, the large intestine, is related to fear from critics. The stomach, for example, is related to event that was unexpected and was not well digested. And I link the organ with the meridians or the Chinese medicine meridians. So we understand if I have, for example, this finger, I have arthritis. I know that this arthritis is due to blockage of the meridian of the gross intestine, and it's related to fear of critics. So if I want to heal this finger, I have to elaborate the psychological aspect related to the fear of critics, because behind it, we have the potential of learning. So we can complete the learning process by interpreting the right way the problem and resolving the problem. And we can see that not everybody will take the same problem in the same way. And this will lead us to the third seminar, where we speak about the human code. I look to the face and I see the face, and I can see, for example, Gary, do you hear me? I can see that, for example, you are very curious, you are a researcher, you like to search for and to understand deeper and deeper the things. You have the male and female energy that are in equilibrium. You are very easygoing person. You are not harsh, you are not hard. You are flowing because you have a lot of water in your constitution. So you are easygoing. However, you had in the past the disappointing because you wanted to do something and you go in certain path, but it was not fit for your path. So you have different occasions of disappointing, and that blocked for you the sixth chakra here. And this could be resolved if you identify this one. And you will see that actually at the age of 17, we can make this experiment if you want. At the age of 17, what you wanted to learn, what you wanted to do. So you can see that from a very few signs that we have, we can see the person, and we can use the blinking technique The blinking technique is a technique that we can make diagnosis with the person. For example, I can imagine that you are here and I can blink, and the blinking technique is using the eyelids. When in my imagination, I put my hand in correspondence of the chakra that is blocked, the eyes will blink alone. So I know what chakras are blocked. The same way I can know exactly when it was blocked, the year, in a way that we can be very precise to help the person to be aware about the problems that still have, and it's important to resolve in order to go on in the path with sense of love, happiness, and freedom. And this is actually the state of well-being. Now, in the third seminar, actually, it tells us to look to the person and to determine what kind of person is, what is the constitution. And I divide the person in 60 different typologies, and each typology has his code. And from the code, you can know the temperament of the person. And from his temperament, you understand his needs. And from his needs, you understand the conflicts that could have, because each one could have conflicts from his needs, not from things that are neutral. So from the face, we can make a lot of diagnosis, and we can understand, and we can guide the person in his path to feel that he's realizing his aspiration and going on the path that corresponding to the original program with which he or she came to life. Now, once we have this kind of diagnosis, we in the fourth seminar, we learn how to resolve this. And the fourth seminar, we have two kinds of intervention. The first one, I call it FEEL, fast emotional elaboration and liberation. And fast emotional elaboration based on the knowledge of the correspondence between the psychological conflicts and the meridians and the chakras. So once we know where the blockage is, we don't need to elaborate this psychologically, because I can intervene directly with the energy that contain the information, and we can bypass the brain and the mind to resolve this. So just I suppose that you have some place or pain, or somebody in the participants has some pain in this moment, or has a fear. For example, has a phobia. Somebody has a phobia. Phobia from spider, for example, or phobia from, yes, Betis. So, sorry, what's your name?
Betty.
Betty.
I cannot go into the MRI or into the CT, into the tunnel.
You know, this is a claustrophobia, right?
It's not really claustrophobia, because I can be in a closed room. But I cannot go into a tunnel.
In the tunnel. Mm-hmm. And why is this?
I don't know.
You don't know. Actually, this takes us to another technique that we learn in the fourth seminar. And this technique is called TTRT, Trans-Temporal Regression Technique. And trans-temporal regression technique, actually, with a very short time, just um, um, without laying down, we can make the person to go back in the time where he is or she is completely aware, there's no hypnosis, and start to remember what happens in the last life. And most probably, in this kind of fear that you have, you actually you have this experience that you are passed through a small place that lead to the death. Could be like this. And when you live the death experience, you will be free from death, actually, because here you have the fear of death, and this could be freed and liberated by this technique, transtemporal. That this technique that we can do it in 10 minutes. You have to just to shake a little bit the person, close his eyes and shake the person, and start to ask the question, and immediately he start to remember what happened in last life. And after the death, he will experience the death, and after the death, he will experience even what happened after the death, where you go, where you went after that, how you meet the commission. There's a commission, a spiritual commission, that you meet this commission, and they give you a life mission for this life. And after that, you come here with sense of freedom, and you can measure this quite immediately if we have a very close place that before it makes you fear. After that, you will see that it completely freed, and you are completely with the freedom. So this is the second technique. If somebody has, for example, a fear of blood, or fear of needles. No, nobody?
Omer.
You are in good shape.
Omer is putting his hand up.
Who?
Omer.
Omar. Where is Omar?
I'm over here. Omer.
Omer. Omer.
Yeah.
Hi, Omer.
Hi.
Omer. What kind of fear do you have?
From blood.
From blood. And
Yeah.
suppose that I just punch you with a needle and you have blood. How much fear do you have from 1 to 10?
I don't know if it's really a fear. It's like I'm blood pressure down and I have a dizziness.
Yes, fainting.
Mm-hmm.
Did you have in the past an event that could remind you this kind of experience?
I don't know.
So in this way, I will try to find out the reason of the problem by the blinking technique, using the blinking technique. Omer?
Mm-hmm.
In 97, how old you were?
One moment. I born 93, so it's 14.
14. Did you
Yeah.
have some fall or accident that you were injured?
14. Maybe from bicycle.
And what happened?
I just fall down by bicycles and open this one.
They took you to the hospital, they make section.
Yeah.
And
No, no surgeon, only tetanus.
And this actually, how did you remember how did you live this experience?
Not really. I just know that I fall down.
Yes.
Not big one.
You see, here's the thing that in that occasion you have the accident and you fall down. Now every time that you see the blood, you just relive the falling down from the experience.
It's happened to me before, so I never like it. Huh?
You never?
I never liked the blood or something like this. But maybe the blood pressure is from, I don't know.
Yes, this is a vagal response that actually makes decrease the blood pressure, and sometimes even the heart beat lower. So this is a reaction, vagal reaction, that makes this as reaction to the past experience that you had, because your body remember your experience in the past.
Mm-hmm.
So this is like a trigger to relive the experience that you had in the past.
Okay.
Okay, so we can free this using the field technique if we have the possibility to exposure you to the blood. So I can show you a needle or something that I want to punch you with the needle. If you have this kind of reaction, what I'm doing actually, before I do this, I free you by putting my finger in the plexus solar here. The plexus solar is the place, is the address of this kind of fear. And from that place, I put my fingers. In a few minutes, you will feel that the fear goes down, 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 till it will disappear. And after that, we try the needle and you will see that nothing happens.
Okay.
This is a kind of intervention that we do in the fourth seminar. In the fifth seminar, we do the emotional and energetic washout, and this is a technique that I use it to just to wash all the psychological, emotional, and energy blockages that we have inside our system. So, if I can show you the film how it takes place, and I think that would be moving. Awesome. Well, it seems that it's compatible now with the video course. I can show you here just an example. I will see that if I can share. Yes, I can share the video. Do you see the video?
Mm-hmm.
So this chap here, 26 years old, with the drug addiction. He's not working, no friends, no girlfriend, no studies. And what I'm doing in the energy wash up is just to give the energy from the head to touch certain points in the body. And he starts to shake his hand because he feels a lot of energy. And when the energy will be, in the threshold, I just fill him out, and he will start to relive the conflict, the trauma that he had. And the trauma that he had actually was that his father left when he was 5 years old, and his mother told him that your father will come back, and till the age of 12 when he discovered actually that his father was dead. He died when he was 5 years old, but he didn't know this, and he was very angry against his father and anger against his mother that lied to him. So this kind of anger that led him to use the drugs, and just to alleviate a little bit the suffer that he has inside himself. And when he lived this, he was completely relieved. And I saw him 1 year later. He was working, studying with girlfriend. And when I asked him about the drugs, he said, "What for? I don't need the drugs." So he stopped alone to take the drugs, and it gives him the opportunity to complete the learning process that was behind the conflict, the traumatic conflict, and to go on in his path. This is the fifth seminar, and the sixth one is the best one, that we go to Brazil, and there we drink ayahuasca, and we enter in the spiritual dimension, and we learn how to deal with psychiatric disturbances, which are influences of the spiritual world that is not, the psychiatrists are not aware about all about this. So we have this journey together. I hope to see you in Germany. I give the word to Carmen. I want to thank Carmen for this organization. Thank you very much for this opportunity, Carmen. Carmel. And we would like to hear from you what you plan for the when you think what would be the seminar.
I could not hear you. Say it again.
When you think that the seminar would be the first one?
The date is in July. We set the date. I think it's the 17th, 18th of July, if I'm not mistaken. But we published that already. Yeah.
Good. I will come that day.
How the whole situation will clear up, and
Yes.
then July. I think everybody has gotten the new dates and put it into the diaries. Hopefully. But yeah, we've got that scheduled already.
Very good. Thank you very much for this opportunity, for this occasion to be with you. I hope to see you in July, and keep a good state of state of mind, and increase your vitality. Make anaerobic activity just to increase your vitality. Drink hot, be hot all the time. The 37 degrees, the temperature of the body, this is our sign that we have a good vitality. And if you have 37 degrees, you are protected against whatever kind of virus.
If I may say something, you're all welcome to log into the Facebook page, the English one and the German ones, and there we summarize the vitality instructions that Dr. Butto is talking about. So you can all have it there written. So just log into Dr. Butto English page or German, the Deutsch, and you'll find it all there.
If you have some question, with pleasure, I will answer the question. Yes, please. Betty.
What if you have already done the energy washout, and what if you already did ayahuasca?
Well, you know, I said that till the point that we didn't reach the light, we have still work to do.
Okay.
The final point for all the reincarnation, we will achieve to the level of the light. So we will find always something that we have to work on and to go on.
Mm-hmm. The list is long. Okay.
Another question that, yes, please, Elizabeth. Again, please, we didn't hear you. Do you hear Elizabeth? Your mic is not.
Hi, can you hear me now?
Yes, now.
Okay. Have you ever had a case where you did the emotional washout and that process of like the young man going through the trauma continued on for many, many sessions and someone never got out of it?
You mean that despite the fact that we are doing the therapy, still have the same problem?
Well, I'm going to tell you that I had an experience where I took an energy washout sort of a workshop. And I went through this type of thing that young man is going through. It went on every day for hours for a month. And my body was so exhausted that I had to stop the therapy.
Well, I don't know exactly what kind of washout you did, but in our washout, there's no exhaustion and there's no need for a lot of emotional expression, because once you express it, today is very short, it shouldn't be long. And the main thing is to complete the learning process. It's not the emotional expression the most important thing, but the learning process that should be elaborated, and this one that makes the difference. So it's not enough to make energy wash out without be aware about the problem and how to complete the learning process. And this is a more important. And the final question. Let me see if there's something that's raising hand or something. Yes?
Anna.
Yes, please.
I don't really have a question. I mean, I have thousands of questions, but I just wanted to say regarding the previous question, every time I had any kind of session with Nader, every time after that, I feel free from everything that weighed me down. So I think you can't compare what we or he does with any other kind of rituals or sessions, so to speak. That's actually all I want to say.
Thank you.
Another thing is important, the question of ceremonies with the ayahuasca. You know, most of the people, they are very enthusiastic about things that are seeing or experiencing. But what we learn in the ayahuasca ceremonies, two important things. The first thing is not to look to the things that you are seeing. And the second thing is to be connected with God. And we learn how to be connected with God and how to put the divine light in our heart and to take this in our daily life. And this is the main thing that we should do, not is the experience by itself that is important, but what we get after that and the lessons we take with us after that, this is the most important thing. And in order to do this, we should have a model, we should have a path, and we should define everything. It's not the experience by itself, but we have to imply and model and to go through this model and to increase our spiritual growth. Because the main thing that is important on all this is we came to life to make a workshop in this life, and the difficulties, problems, and obstacles in life are trigger for us to change and to grow and to evolve. And the happiness, we use the happiness as a sign that we are going in the right path. And we use the suffer, a psychological suffer or physical one, as a disease, we use it as a sign what kind of intervention we have to make or to change in order to take the right path that leads us to be happy and free. So we can summarize in 3 sentences, very simple, our life. Love is the purpose. Love is the way. If we do everything with love, we will feel happy. Happiness is our sign. So we use the happiness as a sign that they are doing the right thing. And light is the purpose. From the light we came, and to the light we'll return. Thank you very much, and see you in July. Thank you.
Thank you.
Thank you.
Thank you, Nader.
Thank you, Carmel. Thank you. Paolo.
Ciao,
Ciao Paolo. Alla prossima.
a presto.
Bye.